Hip rotation is a fundamental movement for our hip joint, which is really important for basically everything we do with our hip. A lot of people will kind of jump into more complicated movements or exercises or positions to work on their hip internal rotation when they aren't prepared for it. Things like the 90-90, which would be something like this, is pretty extreme and advanced, and most people who actually need to work on their internal rotation are not prepared for this type of a movement. So instead, we need to find some positions where you can actually get a nice deep capsular hip internal rotation stretch without getting any sort of closing angle hip pinchiness sensation. And for somebody who has a really big limitation, they're not going to be able to do that here. So one of my favorite ways is actually going into a hands and knees or quadruped position and working on finding that movement from there. So if you have a kettlebell, you're going to use something heavy like a really heavy dumbbell, a kettlebell, or you can even use the corner of a squat rack, something that won't move that you can put your foot on. Then you're going to get into the quadruped position. You're just going to see what hip internal rotation looks like. For the purposes here, that's going to look like rotating your foot away from the other. So your ankle's coming out, your thigh is rotating in. This is hip internal rotation. So once you kind of get an idea of your angle, then you can position your foot on the other side of the kettlebell. You're kind of angled away from it to start, so you don't feel a sensation here. We're just getting our ankle anchored in with the kettlebell. Then from there, we're gonna rotate our pelvis kind of towards that hip. So now I'm getting into a hip rotation. So my femur is staying here, but my pelvis is rotating on the femur. So I'm creating some relative hip internal rotation. What I'm looking for is finding a nice deep stretch in that hip here. It's gonna be really deep in the hip socket. What we wanna avoid is any of that groin, like hip pinching or kind of closing angle sensation. From there, you're gonna hold the stretch. You want it probably at about a 4 to 5 out of 10 intensity, so don't push into it. You may have to play around with the position of your pelvis. So if you rotate more towards, you're gonna feel more you're gonna feel more stretching sensation. As you rotate away, you will feel less. As you sink back, you may feel a little bit more or less. As you stay tucked, you might feel less pinching. And the last way that you can modify this is by moving your other leg in and working on rotating instead of coming out and getting a little bit too much of a strain on your adductors. So once you find that, you're gonna hold that stretch for about 2 minutes. And then from there, if you are adding the PAILs rails portion of this stretch for the strength training portion, you're gonna start your PAILs contraction. For PAILs in this position, you're thinking about that inside ankle bone pressing into the kettlebell and you're rotating your thigh out. So no movement's happening. We're just finding those tissues first. So start to dig into that kettlebell a little bit, feel those muscles engage and contract, turn that contraction up like you're turning the volume dial up, slowly up to the intensity as desired, usually around 60 to 70%. Hold that for 20 to 30 seconds. Once the time is up, ramp it down. Now you're gonna find the rails tissue. Rails is going to pull you into more internal rotation or a deeper stretch. Again, the I stands for isometrics, meaning there's no movement, but the movement we are trying to do or the tissues that we are finding are the ones responsible for this movement here, right? So this is hip internal rotation. So I'm imagining that I'm trying to pull my ankle off, internally rotating my thigh, this type of motion, but because we're at our end range, we're not able to do that. So you're ramping that contraction up. Just find those tissues, slowly ramp them up like a volume dial up to about a 60 to 70% contraction, holding that for another 20 to 30 seconds. And that's going to be your rails. And once you finish that, you've completed the stretch with the PAILs rails portion for that one single leg.